Greetings. In today's discussion, we'll take a closer look at the long-term benefits of stem cells in supporting body repair and regeneration. The human body has an incredible ability to repair itself, but this capacity declines with age, injury, and chronic disease. Stem cell therapy has emerged as a key area of regenerative medicine because of its potential to support long-term tissue repair, regeneration, and overall functional health. Rather than offering short-term symptom relief, stem cells aim to address underlying biological processes that influence healing and recovery. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, also known as the Nutrition Ninja Doc, founder of MyBodySymphony.com and the STEM Region/Age Reversal Technology Center, ARTC-Health. He is a problem solver with a focus on helping people overcome their health challenges and achieve their health, performance, and appearance goals. He is using this avatar to save time making videos that can be better spent helping people. My role as his avatar is to convey his knowledge and insights about health, healing, and regeneration. Please realize that I'm an avatar of a doctor, and none of what I convey should be considered medical advice. It is for educational and entertainment purposes only. Consult your trusted healthcare provider before making any significant changes to your health regimen. Doc Max also provides individual supervision, in person or virtual. Contact us at 941-806-5511 to learn more. Now let's get back to today's topic. Before that, I ask that you leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way to help get these health-related presentations out to more people. Repair and regeneration involve replacing damaged cells, restoring tissue structure, and maintaining proper communication between cells and organs. When this process is impaired due to inflammation, reduced blood supply, or cellular exhaustion, healing becomes slower and less complete. Over time, incomplete repair can lead to chronic pain, reduced mobility, and organ dysfunction. Stem cells play a central role in all healing, repair, regeneration, and maintenance of these repair mechanisms throughout life. As we age, so do our stem cells. They decline in both number and efficiency. Stem cells are unique because they can both transform into specialized cells and release regenerative signals that influence surrounding tissues. Their long-term benefits are not limited to immediate repair, but may extend to ongoing tissue maintenance and resilience. Stem cell therapy may provide sustained benefits for body repair and regeneration through several mechanisms. Continuous tissue renewal. Stem cells may help replenish aging or damaged cells, supporting ongoing tissue maintenance. Improved healing capacity. By enhancing the body's natural repair response, stem cells may lead to faster and more complete recovery from injuries. Reduction of chronic inflammation. Long-term inflammation interferes with regeneration. Stem cells may help regulate immune activity and reduce persistent inflammatory signals. Enhanced structural strength. Stem cells may support collagen production and tissue integrity, contributing to stronger joints, skin, and connective tissue. Better organ function. Regenerative signaling may help preserve function in organs such as the heart, lungs, liver, and kidneys. Support for nervous system repair. Stem cells may aid in nerve regeneration and improve neural communication over time. Improve vascular health. By promoting healthy blood vessel formation, stem cells support long-term oxygen and nutrient delivery to tissues. Degenerative conditions often result from cumulative tissue damage and poor regeneration. Stem cell-based approaches are being explored to help slow degeneration, reduce symptoms, and maintain function in conditions affecting joints, spine, nerves, and organs. By supporting regeneration at the cellular level, stem cells may help delay disease progression and improve long-term quality of life. The long-term effects of stem cell therapy can vary depending on factors such as age, overall health, severity of damage, and treatment protocols. In many cases, benefits may develop gradually as tissues regenerate and inflammation decreases. Lifestyle factors, including nutrition, physical activity, and stress management, also play an important role in sustaining regenerative benefits over time. Although research into stem cell therapy continues to expand, long-term clinical data are still evolving. More large-scale studies are needed to establish standardized protocols, the durability of results, and optimal treatment timing. Of course, such studies are unlikely due to the stranglehold of the medical-industrial complex since stem cells can't be patented. Stem cell therapies should always be pursued under qualified medical supervision and in compliance with ethical and regulatory standards. Stem cell therapy may offer long-term benefits for body repair and regeneration by enhancing tissue renewal, reducing chronic inflammation, improving circulation, and supporting organ and nerve function. While not a universal solution, stem cells represent a promising regenerative approach focused on maintaining structural health, functional capacity, and overall vitality over time. As always, please feel free to reach out to learn more about whether stem cell therapy might be of help. Call 941-806-5511. Finally, this has been presented for educational and entertainment purposes and is not intended as medical advice.